thanking everyone for joining on today's webinar. My name is Ben Brenner. I'm one of the founders of MedPro Disposal. We launched our live webinar series a little over a year ago with the intention of really being able to provide additional content to healthcare providers, whether they're current MedPro Disposal clients or not. Topics have ranged from highlighting some of the existing services we offer to covering trends in the industry to offering continuing education resources. So today we're very excited to introduce our latest solution, which is a managed IT services, and walking through the benefits of outsourcing your IT needs with our trusted partner, Miles Technologies. Managed IT will be offered through our new and exclusive platform called MP1 Solution. MP1 Solution is being positioned to offer healthcare providers with really a single entry point to a wide array of solutions that your staff and physicians are, have a need for. Our goal is to do the exact same thing we did with MedPro in the medical waste space, which is to offer solutions you require at a fraction of the cost that you are paying. For most providers, switching to a managed IT service can really help streamline operations and provide some additional security and compliance with regards to PHI and HIPAA regulations for significantly less than you may be paying today, or that if you were to go out and do it on your own. So I want to hand over real quick just to Jeff Miglico. He is the president of MP1 Solution, and let him do a brief introduction, and then we'll hand things over to Miles Technologies.
Yeah, thank you, Ben, and hello, everyone. Again, thank you so much for everyone's taking time out of their day to attend this webinar. Now, as Ben mentioned, so we have a team of specialists that are really working diligently to make sure that we're providing all of to all our current and future clients, the absolute best support services for their business during, challenging times like now, especially during the pandemic. We'll really continue to proactively share these new ideas and new offerings, and especially provide education on these relevant topics to help keep you informed and to hopefully help everyone identify and eliminate any unnecessary risk during these times, and especially improve the efficiency of your business as we all recover and move forward. Now, with that said, I'm going to turn it over to Ryan and his team, who've put together really a wonderful presentation on probably our most relevant topic of today, which is managing and supporting the technical aspects of your business during and after this pandemic. So with that, I'll turn it over to Ryan. It's all yours.
I appreciate that, Jeff, and Ben. Thank you guys for the warm introduction, and thank you for giving us this opportunity to speak with obviously you two and your clients as well. I'm Ryan Cody. I'm a senior technology advisor at Miles Technologies. Unlike Taylor Adair, who will introduce himself in just a moment here, I'm more of a technology generalist, right? So I deal with all industry verticals and basically consult them on the benefits of outsourcing their IT support services, whether that's help desk, security services, network administration, business continuity, disaster recovery planning, or all of the above. That's my position here at Miles Technology. So work across multiple verticals, obviously work with medical practices as well, consulting them on the benefits of outsourcing. And I'll let Taylor introduce himself.
Yeah, sure. Hi, everyone. Thanks for having us and spending a few minutes with us today. Miles Technologies is organized around industry verticals. I lead the strategic consulting team that is focused on healthcare. So all of our customers are folks like you, and as a result of that, and the associated support team is also focused on customers just like you. So we're very familiar with the issues that you are facing in these trying times right now.
Excellent. Appreciate that, Taylor. So let's hop into the agenda. We want to make sure that this is, you guys run busy practices. So we want to pack as much great information in this period of time that we have that we can, and also leave a little bit of time at the end for questions as well. And obviously you'll be able to follow up with the MP1 team following the webinar if you have additional questions or additional interests in their services. So the agenda, why shouldn't you go it alone when it comes to IT support for your practice? We're going to take a look at the benefits of partnering with an MSP. Now, if you see the word MSP, for those of you who aren't familiar with the industry lingo, that stands for managed service provider. So IT managed services provider. So the benefits to partnering with an MSP who specializes in medical practice IT support, why that's important. What to look for when choosing a vendor, extremely important. There are as many varieties of managed services packages out there as there are IT services companies, and nobody provides IT managed services in the exact same way. So we're going to coach you guys on what to look for when evaluating a service provider. Telehealth. So obviously huge, right? In the age of COVID, a lot of you probably, most of you may be experiencing your first experience with telehealth. So we're going to cover that, how to make sure that your video conferences, that your teleconferences are safe, secure, and are able to provide, or you're able to provide the appropriate care to your patients, similar to the way you would in your office. And then steps to take from a technical perspective when opening your office up again or getting back to seeing patients at normal/full capacity. So what do you know, maybe you guys have been running on a skeleton crew or at half staff or quarter staff. Now that, hopefully everybody's starting to return to their offices, what do we need to do from a technical perspective to prepare our networks and our environments for that? All right, so you're a doctor. Well, maybe some of you aren't here. Maybe you're practice administrators or practice managers. But either way, you're a busy professional. You can do it all. You're competent. You know what you're doing, but you don't have to. You don't have to do it all. And what we see a lot of times with medical practices in particular is they're run by very smart, very capable people that like to dabble, right? They like to dabble in technology. They like to troubleshoot here and there, when really the focus of the practice needs to be on patient care. So what we want to do, what MP1 Solutions wants to do, is take the burden, and it is a burden. They want to take the burden of IT off your shoulders so you could focus on your practice, growing your practice, patient care, all the things that really matter, and we'll take care of the IT support for you guys. So again, you have a practice to run. Patient care needs to be your number one priority. There's a lot that goes into technology support at a medical practice, but your only/main concern should be the care of your patients and providing world-class quality patient care. Benefits of outsourcing IT support to an MSP, a managed service provider that specializes in supporting medical practices. And everybody in attendance, this part is so important when we're not talking about evaluating providers yet, but you want to work with an MSP that has experience supporting medical practices. Why? Because they understand the day-to-day support requirements of a medical practice. We know that you can't be down, that you need stuff like yesterday. You can't afford to wait for support. So if a machine goes down, if you're having trouble connecting to your EHR, EMR, if you can't print out records, if you can't view if you can't view an X-ray or MRI, wherever the case might be, that is impacting your practice, and it's negatively affecting the quality of care you're providing to your patients. You need immediate access to files and data. You can't wait. When you actually, I had an appointment yesterday with my primary care, interestingly enough, and she was late coming into the appointment because, lo and behold, her computer was down. So you don't want to be in that situation. And then in the COVID era, or in the age of COVID, you should be able to practice telehealth reliably and securely. So as many of you might know, states, because of the COVID situation, states loosened the restrictions that they placed on practices to practice telehealth. And we anticipate that a lot of the changes that were made in terms of practicing telehealth will become more permanent. They understand HIPAA. So an MSP, a managed service provider that specializes in providing services, IT services to medical practices, understands HIPAA. They can help put the reasonable and appropriate, HIPAA's words, not ours, reasonable and appropriate security controls in place to protect protected health information. And they could implement a HIPAA security and compliance program. What does HIPAA look for? Policies and procedures regarding handling PHI, annual user testing and training, annual HIPAA security audits, and then a central location really to store all of your HIPAA related documents to show proof that you're taking all of the above steps to stay HIPAA compliant. Or back in the old days, it used to be a big, they would call it the HIPAA binder. Now today with technology, there's a lot of good online portals and tools that you could use to track and organize all of your HIPAA compliance documentation. And then number three, a provider that specializes in IT support for medical practice can help you evaluate the ever-evolving technology landscape to make sure that you can leverage technology to be a strategic advantage for your practice. And you don't want to partner with an IT service provider that is going to implement technology just for technology's sake. You want to partner with somebody who knows the technology landscape and can help you implement the technologies that are going to improve your patient care and improve the overall efficiency of your practice, while at the same time in the most cost-effective manner. How to evaluate an IT service provider. So extremely important here. As I mentioned previously, there's as many providers, or there's as many ways to deliver these services as there are providers out there. So experience supporting medical practices. Again, you want to partner with a provider that has experience supporting medical practices. You don't want to be the first one. You don't want to be the test dummy, so to speak. Flat monthly fee, remote and on-site support. You want to make sure that remote support's covered, on-site support's covered. A lot of MSPs will charge additional for any on-site support requests that are made. You want billing to be, and this gets to a point a little bit later on, but you want billing to be as predictable as humanly possible. MSPs, managed services providers, are notorious for nickeling and diming their clients. So they'll start in with a lower flat fee, but then every time you make a request, or every time somebody has to come on site, or anytime they have to call Athena Health or whoever your EHR, EMR vendor is, they're charging additional money. You want to make sure that your flat monthly fee is just that, a flat monthly fee, no additional charges unless there's significant project work that's involved. Offer full suite of security and proactive support services. So you want an MSP that bundles all of the security and proactive support services together in one package for you. So you don't have to worry about purchasing and deploying antivirus on your own. You don't have to worry about purchasing and deploying other security tools like Cisco Umbrella Protection or Spam Protection. That you want to make sure it comes in a bundled package together for you that your MSP is going to manage on your behalf. Acts as a vendor liaison for other technology vendors. That's hugely important. I mean, how much of your time, especially if you're an administrator or even an owner of a practice, how much of your time is spent wasted just trying to chase down vendors, and you're on hold with your internet service provider and your phone system provider and your EHR provider and whoever else is out there? How much time do you waste spending on the phone with those other technology vendors, working with them to troubleshoot issues? You want an MSP that's going to quarterback all those relationships for you and work with them on your behalf until any issues that you encounter with them are resolved. Dedicated assignments to your practice. You don't want to be calling a huge call center and talking to a different person every single time. You want to be working with people who are familiar with you, your staff, your environment, and can hop into your environment and begin troubleshooting issues immediately with familiarity. Handles asset management, another huge one, very closely related to vendor liaison. Asset management is the bane of any office manager or IT manager in a medical practice. You want to look for somebody that's going to handle that for you. Conducts regular strategic meetings and support reviews. So, we just don't want to kind of be surviving on a day-to-day basis. We want to have a overall vision of technology and where it's taking our practice. So having these strategy and planning meetings is extremely important. So you want to provide a vendor that's going to provide those two on a regular basis. And then simple and transparent billing. Again, MSP is notorious for nickel and diming. You want extremely simple, extremely transparent billing when it comes to partnering with an MSP. And with that, I'm going to turn it over to Taylor Adair, who's going to talk to us a little bit about telehealth in the age of COVID.
Yeah, thanks, Ryan. I appreciate it. That's an awesome overview. Just to zero in on telehealth a little bit, because a lot has changed and it seems like almost overnight, right? I mean, telehealth is not new. It's been around for a long time, but it's been hard CMS only had a few payment codes that would apply to telehealth, so it was hard to get paid. There are all these, HIPAA security requirements, so it was hard to use telehealth and to make sure that you were still going to be HIPAA compliant. Now there are also, there's some federal funding available to encourage it, and I think also there was this perception. Well, there's definitely some resistance, on the clinician side to using telehealth, right? Because the paradigm has been, office-centric, face-to-face, healthcare. And I think there was kind of an assumption that there was going to be resistance on the patient's side too. Now enter COVID. I mean, nobody would wish this on anybody as a way to accelerate adoption of technology, but that is what has happened. I read a study that reported that 2/3 of people who accessed healthcare so far during the COVID-19 pandemic, at some point in their healthcare made use of telehealth, and that of those, over 50% of them thought, reported a positive experience, thought it was just fine. So it's gonna be hard to get that genie back in the bottle, and as long as remember Hurricane Katrina, thousands of paper healthcare records were lost, and that was part of the motivation for the government's push towards electronic health records, and made a long way. This is the next giant push, and I think what's going to be different here is that patients are going to be behind it too. I mean, there's just not going to be a way to now tell people that they have to actually come in to the office for certain kinds of care. So just to zero in a little bit on, what do you have to think about when you implement telehealth? Ryan, if you could just go to the next slide.
Absolutely.
Thanks. There are a few things that you want to keep in mind, and we'll go into detail in the next couple of slides, but to the extent that you can, you want to have, we're going to call it here an all-in-one video conferencing solution. And what does that mean? I mean, so you have things like Zoom, right? And Zoom is great, and Zoom for healthcare is, even better. But it does not integrate with all the rest of your workflows. It's hard to manage a you can't manage, it's not a waiting room that you can manage. Other doctors can't access and manage. It's hard to load level the work. It provides a good basic kind of entry system. And by the way, we love Zoom, and we have loads of healthcare customers who are using it and like it. But when you start thinking strategically down the road, and if you accept that this isn't going to go away, that's how you have to think about it, so that you don't end up implementing it twice. So you want to have a video conferencing solution as much as possible that will integrate in with the rest of your workflows, not just provide video and audio. You're also going to want to make sure that you have up-to-date devices. Now, this is a little bit of just IT blocking and tackling, right? Because these have to work, they have to be patched, they have to be secure. And so you're not going to be able to use, 7 or 8 or 10-year-old devices and be very successful with this. The communications are going to have to be secure. Encryption is going to have to be everywhere. Anywhere data is at rest, ideally, it's going to need to be encrypted also. In terms of telehealth, systems that don't actually store any data are great. That eliminates some of the complication there. But this needs to be paid attention to, because when the HIPAA, HIPAA's not going to be relaxed forever. And when it comes back, these are some of the things that, are going to have attention paid to them. You also just want, today everybody on your phone, on your tablet, everybody has access to fantastic quality, production quality of video and audio. And if your telehealth solution isn't up to those standards, first of all, you're going to have a patient perception problem. They're going to go, well, what kind of system is this? And also, it's going to limit your ability to actually do your jobs if you're a clinician, because, say you're a dermatologist, a very high quality image is going to be more useful to you than one that's not so great, or maybe there's not even an image and somebody's trying to describe their skin issue, just using words, which is hard. So investing, you don't have to spend a lot, but, instead of the $15 webcam, the $60 or $70 webcam is a really good investment. And you want to make sure that, you're communicating a professional image just by having an office-like, setup. So as I mentioned, HIPAA's not going to go away forever. And ideally, you'll settle on we suggest picking a telehealth solution where they are following the same rules that you are, basically. So even if HIPAA comes back all the way, which it really could, if you have a platform, and Doxy.me is not the only one, they're just a great example, and they publish a lot of information about it. They don't store any information, so you don't have to worry about that. They are operating in accordance with the same HHS, privacy and security rules that you are. So, all that stuff that you have to do to be HIPAA compliant, they do as well. And the rest of these bullets here are details around that, except for the last one, signs a business associates agreement. There are a number of platforms who I think, would be okay to use, except they won't do a BAA. And that is a linchpin of HIPAA compliance. So even if that is relaxed in the short term, that's going to come back. So there are a few examples and things to think about. And of course, we do a lot of consulting around helping people pick solutions. Zoom has hang on there, Ryan. Zoom has two versions. Actually, there's just Zoom that everybody knows, and there is Zoom for Healthcare. Zoom for Healthcare, if you use it correctly, can be HIPAA compliant, because they do things as soon as you sign up for that, they do things like disable cloud recording and set a whole bunch of other things. So Zoom is fine. Microsoft Teams, also fine. Microsoft will give you a BAA. Skype for Business, also fine if you're on the E3 or E5 licenses. GoToMeeting is fine. Doxy.me, also fine. And actually, the more I learn about Doxy.me, the better I like it, but it's great. Surprisingly, though, Zoom, just regular Zoom, isn't. There are some security settings that can't be disabled, and also under regular Zoom, they will not send you a business associates agreement. So there's no way that could be. Skype, same thing. And then there are a whole host of social media platforms like FaceTime, Facebook, and others who, if you're using these solutions, it's great. And if you're able to, triage COVID patients using these tools, which I think was kind of the motivation behind temporarily making them okay, that's great. But if you're strategically planning your practice, you probably want to not invest too heavily in these tools that are not going to be a little more robust down the road. So just a couple of general thoughts on how to go about this. Be strategic. There are all kinds of tremendous needs that have to get satisfied right now, and if you have to do some kind of quick and dirty or cheap or free solution to triage your patients, of course, that's great. But if you have the luxury of being able to think a little more long-term and strategically and how you're going to invest in this technology and make the best use of it long-term, now's the time to do that. If you have folks using telehealth platforms who are not, let's just say, super comfortable on video calls or on social media, or they just haven't had a lot of practice at it, it's a great idea to practice, even if it's just amongst yourself, do some role playing to just make sure that everybody is comfortable being on camera. They can smile once in a while, they can look at the camera, the lighting's okay, the sound works, they know how everything works, and it'll just make the patient experience tremendously better, because the patient will understand that, as you count on your clinicians, that they've kind of got the situation under control. And finally, I know there are lots of people, not just in healthcare, but everywhere, who are just shy about having their webcam turned on. Got to get over that. There's a huge difference in the, in the patient experience based on whether the patient can see the clinician that they're working with or not. So finally, and Ryan, I think you can just put all these up.
Okay.
There are, there's a sequence of steps that you can go through at whatever stage you are in going back to full capacity. Some recommendations here are, don't try and do it. Whoever your IT team is, whether it's an MSP or whether it's your cousin or, whoever, work with them, because you'll certainly have enough stuff to do anyway. Test, make sure, especially if you're adding capacity, make sure that it's rock solid before you start putting patients on it. Make sure everybody knows what's allowed, what's not allowed. What is a HIPAA compliant use of a video? You can't do sessions from Starbucks, right? There's some rules that you gotta follow. What are the requirements for working in the office? What are the requirements for working from home? These are all things that you will really thank yourself for making sure that they're clear and written down as you sort of move into what is going to be the new normal. And talk to your team. They'll have lots of feedback about how it's going in a home, what's good about home, what's good about the office, and ways that you might be able to help. And again, I guess maybe just a hazard of working on a consulting team, think strategically, plan for the future. You, in the longer, by spending a little bit more, really just a little bit more now, you can have a much better long-term solution. Thanks.
Thanks, Taylor. I guess at this time, we'll kick it back to Ben and Jeff and, just, I guess, open the floor up to questions if we have any.
Yeah, I think, I think what might, be helpful to understand, especially if someone hasn't used an IT service. So I'll give a little context here for everyone who's attended and how we kind of found Miles and settled on it. So we used to run, especially when we were a young bootstrapped company, used to run IT through a combination of me being the point person, which I can tell you is not a great way to get things done during the day, with people needing passwords reset or can't connect to the guest Wi-Fi or whatever it might be, something small like that. And that's the stuff I could handle. Never mind, if there's a major issue or an outage. So, we were really looking for a solution that allowed us to kind of be out of sight, out of mind. And when it's something like, and I think Ryan, you mentioned this early on in the call, when we have an internet outage, I don't know how many of you guys enjoy being on the phone on hold with AT&T Fiber for an hour and just to be told that they don't see an outage in your backyard. So unfortunately for Ryan's team, the task falls on them. But you're getting that with the managed service, and we've put together what we've enjoyed is with employee onboarding. We've got a ready to go checklist. What software needs to be installed, what devices are managed. what is our password policy, and they can manage both on-premise. So if you have a local server or software that runs just on machines, they can set that up. And then if you're using any cloud providers, whether that's telehealth or Office 365 or Google Apps for managing your email and work documents, they can help ensure you've got security and controls in there as well. So what we really enjoyed is that it allowed us to kind of have a fixed rate that could adjust and scale as our business grew and as our needs expanded. And if we have to do special one-off projects, we work with their team. They provide free consultation on, okay, here's your options. Do you want to go this route? Do you want to go that route? Here's the pros, here's the cons. And it's been a really enjoyable experience these last few years. And we, prior to that, we worked with a few other some local companies who, promised, okay, we can be there for you and we'll be on site. And what we found is with the approach Miles offers is, first off, 97% of what you ever need is going to be remote, right? So the on-site, I would say, isn't always necessarily something that you would need. But in the event that there is an on-site need, we've never had a long period of time. Miles can have people, if not same day, first thing the next. With backup disaster recovery plans, if something should fry our firewall or hard drive, we've got a shipment that's coming the very next day. So it really does provide a lot of peace of mind for us there.
Yeah.
So your comment looks like we're having some feedback on the audio, so maybe I don't know if something's picking up from the muting. We'll try to work on that. Apologies in advance, or I guess not in advance, but this is our first go around with this new webinar software, so still kind of working through some of the things with it. So Jeff, anything you want to cover?
I think we've got a couple of people trying to ask questions. I'll just open up the floor at this time and let people go ahead and start asking their questions. We'll go through that. I know we've right at the 30-minute time mark here. Ramilia, I think you've got a question. I'm going to open it up so that you can talk as well. Okay, we've got one, Ramilia Temez. It's got, I think you can click on your, it'll allow you to unmute your mic so you can ask a question. No, all right, maybe having some technical difficulties. Okay, well, look, I think, Ryan, unless you have anything else, I think it's good for us. We can go ahead and close the presentation. Look, this was, we really appreciate everyone showing up. We are going to have a few follow-up items to this to help connect with each one of you. If you have any questions that weren't answered here, we can answer those. Those listening to this presentation after the fact as well, feel free to reach out to us. Ben, I believe you've got a link to a form where people can request a free consult from. Yeah,
we'll be, I'm sending that out right now. Everyone can request if you want to do a follow-up, Jeff and the Miles team can put together just a walkthrough of your needs, how many employees, how many devices, some basic facts there that they can then put together cost savings comparative analysis for you for your office or offices if you have multiple locations. I know we have a couple here that is managed by Miles, and again, most of the times it's remote. I see we do have a question from Phil. Looks like you said on-site's important. How do you handle on-site support in a market like Boise?
Yeah. So if you want us to field that, Jeff?
Yeah, go. Yeah.
So Miles and MP1 in particular, we are staffed nationally. So we have boots in the ground in all 50 states. Now, I don't have my CRM or ERP open right up in front of me. If I did, I'd be able to tell. I could do a quick query and see how many employees, if any, we do have in the Boise area. But I can tell you from our perspective, what we'll do is if somebody's, and Boise is a growing town, so I'm sure we have people there. But what we do in locations where we don't have staff, we have what we call our rapid response recruiting team. Now, I mean, I think we may be the only IT service provider that does this, but we will actively we're upfront with our prospects at the time. And I just had this conversation with somebody who had an office in Las Cruces, New Mexico. They had multiple offices in Texas and then one in New Mexico. We didn't have anybody in Las Cruces. So what our rapid response recruiting team does is they will tap into the local pool of IT talent, a lot of IT professionals, a lot of quality, let me say that first, quality IT professionals like to take on part-time work. So we'll hire them part-time. They go through the screening, they go through the background checks, they go through the technical training. So it's not like we're just picking up any old, whoever, John or Joe or Nancy off the street and throwing them in there. They have to meet qualifications just like our full-time employees would, but just at the time, we don't necessarily have the customer demand to hire full-time, so they work part-time for us. And as we grow in certain regions and certain areas, it's how we've grown our company nationally. We will hire them full-time, and then our full-time team grows in those areas. But does that address your question about how we would provide on-site support to somebody in Boise?
Yes.
I hope it does. Yeah.
Yep.
Excellent. And that's the great one. We could certainly follow up on that as well. Ben and Jeff, if you have the gentleman's information who asked that question, I'd love to get more in depth with him about how we address on-site IT needs, any location across the country.
Yeah, great. He said it did answer the question, and then I think that's some good material to certainly include in a follow-up to everyone who attended here.
Excellent.
Let's see if there was a few other questions I saw here. We discussed the on-site. Anything else that I missed? What how does the after hours work? So while we're on the subject of support, in a time of need, how do you typically do your after hours? Is there a process in place? Does it vary based on where they're located, or how's that structured?
I'm happy to field this, but I don't know if people are sick of hearing me talk. Taylor, do you want to give this one a go?
Sure. So first of all, there are a couple of different kinds of support plans. You can have defined support hours or 24/7. And honestly, though, that doesn't change the support that's available. If you're on a defined support plan, but you need help on a Saturday, you just call. We support you the same way we would if you were 24/7. There might just be, a small fee for the after hours charge. In terms of the supported hours, those are in your local time. Our headquarters is in New Jersey, but if you're in California, then your support hours, it's 7 a.m, your time, not our time. And the same applies wherever in the world you go. If you travel to, London and you need support, but the middle of the night here, you're still supported. One of the great things about working with an MSP who is a little larger is that we can, those sorts of organizations can have 24/7 coverage in terms of availability of technical resources.
Great.
Excellent. Great questions. What else do we have? Those are great.
Looks like that's it from the audience here.
Okay.
Like we mentioned before, there's a link in the broadcast section if you want to request a free consultation. We'll also send a copy of this recording as well as some additional resources and information to everyone. We ask, do not hesitate to reach out. If you have any questions, even if it's just a simple, could you do this? Could you manage this? Or what's the, cost to support X, Y, and Z? We're happy to answer those questions. We know for a lot of providers, working with a outsourced IT company maybe is, something new. And I think once you kind of start to explore that, you realize the benefits that come with having a resource and having a resource that's got the expertise and the talent pool and the reach that Miles Technologies does. And look forward to hopefully being able to provide that solution for as many of you as possible.